Can you sit? Good girl. Couldn't you get down? No, get down. Good girl, okay. Darn, that was pretty darn good. Happy Friday, Baylor College of Medicine and friends of Baylor. Well, of course, a federal judge in Florida has struck down the CDC extension on masks. I mean, so in times like this, I don't know who to ask, so I turned to Lily and I said, Lily, does it make any sense whatsoever that a federal judge who has absolutely no knowledge of public health would make a decision about public health? So it was only Lily Kane. She looked at me and she said,
All rise. The Honorable Judge Lily Klotman. Court's in session.
And just so you want to know, she's willing to serve. So Lily is willing to take over that judge's role at the bench. Anyway, more mask politics. I love the politics of masks. City of Philadelphia has decided to reinstate its mask mandate. I have no idea why they're doing that. Infections are low. It is going up a little bit, but I think that probably is a mistake. We're going to need to do it when it gets bad again. But right now, I probably wouldn't have done that. But, Philadelphia does what it wants to do, as always. And also, universities now are having a lot of outbreaks, and so many universities are reinstating mask mandates. Harvard has decided to let the professors decide in their own classrooms, but American University, Columbia, Georgetown, Johns Hopkins, and our own Rice University has reinstated mask mandates. And of course, in Texas, unfortunately, all the airports are no longer mandating masks on aircraft, at the airports, on Metro, and Amtrak. So it's kind of, unfortunately, I think it's over. We're not going to be able to deal with it. And frankly, at this point, I'm not sure even the extension by 2 weeks was all that important. But the fact that a federal judge feels they should intervene in that is beyond me. So a lot going on in the world. Shanghai, fascinating approach to the zero COVID policy. Everyone's locked up in Shanghai. It's 25 million people screaming and yelling. I mean, it's sort of work. I'll show you some data. It's kind of working, but I don't have no idea why they're doing that. Of course, I mentioned last week, Prime Minister Boris Johnson was fined for breaking his own rules. You can't make it up. You got to love it. New Zealand, who doesn't like Australians, is now welcoming them back, even though they have kind of an outbreak. So, it's sort of fallen apart in terms of regulatory mandates. So one of the sad facts is the world has passed now over 500 million cases. You got to figure the reporting is much, much lower than it really accurate. It's probably not very accurate. So my guess is at least a fivefold more cases have been actually have been infected. So if it's 500 million, there are 8 billion people in the world. So that's 2.5 billion probably cases that have been truly infection. And then there's about 11 billion vaccine doses been given. So that's about another 5 billion. So you start getting to 6 or 7 billion people who are vaccinated or exposed to the virus, you can understand why things are beginning to get better worldwide. So if you look at the world data, you can see, we had that big Omicron BA.1 peak, BA.2, and it's coming down. I think it's coming down because more and more people are just getting exposed to the virus, and the rest of them, who've been vaccinated, hopefully have some immunity. So we're coming close, I think, to sort of a worldwide immunity, and we'll just have to wait and see if we have a new variant. Interestingly enough, if you look, the one new area that's kind of a hotspot is our friends in Canada. They're moving up in terms of the incident. They're up to 44 cases per 100,000. But again, if you look at the change in number of cases over the last 2 weeks, China leads. I mentioned this last week. They're still in the lead. And I want to show you the peak in China. It's finally coming down. It went up very steeply. It's beginning to come down. And then remember, I compared this to the United States because it looks like a giant peak, but if you compare it to the U.S. numbers, it's well below. But it's beginning to approach our numbers. So you can see now that little peak is getting close to the U.S. numbers. So, I mean, they do have an issue. I'm not sure the way they're managing it is the good way. I mean, I'm pretty sure it's not the right way. But, that's what the Chinese are doing. Now, I mentioned last week, Europe had a peak a couple of weeks ago, and it's now beginning to come down. Also, we tend to follow Europe by 2 to 3 weeks. We're beginning to see our little peak coming up. I don't know how bad it's going to be. I anticipated that we would begin to see a bit of a surge over the next 2 to 3 weeks, and I still think that we will. Surprisingly, the Institute for Health Metrics and Evaluation in Washington, for the first time, is not predicting a peak. So I don't know what numbers they're looking at, but I think they're wrong. I think that we're probably going to see a surge over the next few weeks. And actually, if you look at our numbers, we are beginning to see a little tick upward. I don't think it's going to be a huge spike, but I can't imagine we won't see a peak, and there's some evidence for that. The more disturbing thing is we're almost now at 1 million deaths. And we lead all developed countries, the Western countries, with deaths. So if you look at cumulative deaths throughout the pandemic, we're number one in total number of deaths. And even if you look in the recent Omicron surge, we're way ahead of everybody else, which is really kind of unfortunate. And part of the reason is we have the least vaccinated people. So we are behind all the other countries in vaccine percent versus everyone else. And we don't have, it's not like we're the oldest community. There are many countries that have older patient population, but we are leading in deaths, mostly because we lead in the share of unvaccinated, and we also have the highest risk factor, so we lead the world in obesity. So between the fact that we have an unvaccinated and a high-risk population, that's probably why we are leading the world in deaths. Now, if you look at what's going on in the U.S., we're beginning to see a little bit of a surge in the New England states, Colorado, parts of Texas, Alaska, and Puerto Rico. That's pretty much the same as last week. But this is really interesting. This is the CDC wastewater analysis. And on the one hand, they look at total viral limits, and the virus load in the wastewater is pretty low, and that's all these blue dots here. So the red dots is hot, blue is cold. So it's not a lot going on there. But if you look at change, just the directional change in wastewater, there's surges in the Midwest, in the Carolinas, in New England, Colorado, Utah, and Texas. Now, when the wastewater virus burden is going up, that means there are more and more cases. So I can't imagine over the next 2 weeks that we won't see a surge in cases in those regions. And frankly, in Harris County, we were looking at it last week. A lot of places are negative, but the green dots are negative, but you see the red arrows. Those are all areas going up. And this is kind of cool. This is a heat map of every one of the samples of the wastewater in our Harris County. The red is hot, blue is not, and you can see each of the peaks were pretty predicted, very well predicted by the surge in wastewater, and this is where we are now. So it's not as hot, but it's going up. And that usually predates a number of cases going up. So I'm pretty sure, despite the IHME predictions, we won't have a surge. It's hard for me to believe we're not going to see an uptick in cases. But right now, we're good. Right now, Texas is looking good except for a few counties, but Harris County and our friends, of course, in Dimmitt County are down to their lowest ever, which is great. In the medical center, we're down to, I hope that we're always around 200 cases. We're at 300 last week. We're at 388 this week, so beginning to see a slight uptick. But the good news is it's not being reflected in hospitalization. So again, giving more credence to the fact that Omicron variants, while highly infectious, are not as virulent. And so you can see our hospitalizations continue to drop. We're down to 54 hospitalizations in all of our Texas Medical Center hospitals, which is great. The BA2 variant is the dominant variant. It's now up to 90% of all isolates in the United States. This is CDC numbers, so that looks very good. And there's been some really interesting new developments on the vaccine front. So Moderna just announced the results of their bivalent vaccine. You remember, I think about four or 5 months ago, I mentioned they were looking at a vaccine to the South African specific strain, the beta strain. And so the results have come out from that. This was a bivalent vaccine. It was to the original Wuhan isolate plus the isolate that emerged in South Africa, the beta isolate. And they equal amounts of both of the spike proteins given in 50 and 100 microgram doses. It's a third shot as a booster. And what they demonstrated was that you got a strong immune response. They kind of hyped the results a little bit. They said, superiority against the two shots, but it wasn't comparing a 3-shot regimen of the original to a new 3-shot regimen. It was comparing 3 shots to 2 shots. So yeah, I mean, you did get of course you're going to get a boost. So, it doesn't answer the question that we really want. Is it better than a booster with the original Wuhan isolate versus, Wuhan plus beta? So I don't know. We'll have to see. They were kind of hyping it a little bit more than it deserved. The right study hasn't been done, which is really to compare the different boosters using an Omicron-specific or a beta-specific spike protein compared to just the standard original 3rd dose. We'll have to wait and see. There was a really interesting paper that came out of Israel that I think is, speaks to the issue of vaccine strategy. Remember, about last year, I think I was talking about the Klotman bar, and the only way you could get a drink is if you had to get vaccinated as you walked in, because you think about it, those are the people who are spreading the virus. So younger people are the ones who are actually spreading the virus. So this is a mathematical model looking at whether or not if you vaccinated young people, particularly those under, in the under 16 age group, would that be beneficial in terms of lowering the effective R number? Now remember, the R number is the infection number. So if an R number of 1 means if I walk into a room of 10 people and I'm infected, I will infect 1 person. And then that's sort of a linear kind of infection rate. It's linear, 1 infects 1, 2 infects 2. Above an R number of 1, it becomes logarithmic. And so you can see an R number of 1 is linear. Above R 1 equal to 1, it's logarithmic, and below, it doesn't sustain the infection. So this was calculating the effective R number if you vaccinate younger folks. So they looked at, if we were to vaccinate kids under the age of 16, what would the effective R number be? And what you can see in the green line is it drops very dramatically. So in other words, by vaccinating the people who are spreading the virus, you effectively reduce the infection rate number. And the other thing they did is put in the schedule of vaccine. So the sooner you do it, the better. So the brown dotted line shows that you're getting a much better response than a vaccine strategy that's later. So the conclusion from that, at least from a mathematical model, is vaccinate the people who are spreading the virus around and do it as soon as you can. So when we talk about this problem with not vaccinating 11 and younger, it's not only whether or not it's useful for them, it's really how it reduces the spread of the virus for the entire population. And that's why we can't just think about, oh yeah, everything's fine with adults, but the kids are over there. We're all part of the same pool, and we need to vaccinate everybody. There was also a really interesting new anti-COVID drug that came out. The drugs like Paxlovid made by Pfizer that inhibit viral replication are really intended for early infection, not too ill, outpatient medicine. Somebody comes in with a positive, you give them Paxlovid, and they get better. But what about very, very ill patients in the hospital? So there's a new drug called sabizabulin, which is made by Veru Inc., and it's a really interesting, different kind of class of drug. It affects what's called microtubules in cells. So once a virus gets in the cell, it moves around the cell through these sort of skeletal proteins. And by disrupting that skeletal transport system, it prevents the virus from getting to where it needs to be. So it was really interesting. They looked at 52 trial participants who were severely ill, and it turns out it reduced the death rate by 20%. Now these are people who were like severely ill, but it was so impressive a result that the monitoring body decided to stop it. So real exciting. It's not been reviewed yet by the FDA. It's not been peer reviewed, but it may be a drug that's very useful for treating severely ill people. So that's very positive. So the other really interesting thing is the FDA is finally, there's a new test out and the FDA has approved a test called Inspector. It is a breathalyzer test, and what's really interesting is it picks up sort of volatile compounds that are in the breath. There's 4 or 5 it detects, and it's kind of a signature for COVID. Turns out it's actually pretty good. It's 91% sensitive and 93% specific. It's a little box you breathe into. It can be point of care kind of testing, so it's actually very, very interesting. If you compare that to like the antigen capture tests we use for the nose, its sensitivity of those is pretty low, 70%, but they're highly specific. So in a screening test, what you want is the sensitivity to be high. You really want it to be 100%. You want it to pick up every single person that's infected. So this breathalyzer actually picks up more cases than the antigen capture test. So that's actually a pretty interesting thing. We'll have to see if it can be used in broad use in doctors' offices and in hospitals or any place that you're looking for screening. You just blow into it and you get a result in minutes. So it's actually pretty exciting. We'll have to see. It's not perfect. It doesn't have 100% sensitivity. And if it was positive, you would have to confirm with a PCR test. Anyway, pretty exciting news on the front with some interesting new science. So finally, I want to end this week with shout-outs. First, a big shout-out and thank you to Congresswoman Sylvia Garcia, who was here last week to announce a $1.1 million in federal funding to Baylor as part of the Congressional Community Project Funding Program sponsored by Congresswoman Garcia of Houston. And these funds are intended to expand our efforts to treat long COVID in Harris Health and the Strawberry Clinic in East Harris County. And I just want to show you the check. It's right here. I've been looking all around town for an ATM that will take it. I've been trying to get into mine, but I think it's good. I don't know. I'm waiting for somebody to cash it. And then finally, Hardeep Singh, professor of medicine at Baylor College of Medicine, has been recognized with the John Eisenberg Patient Safety and Quality Award. He's the Chief of Health Policy Quality Informatics Program at the Bakey VA. Very, very great award, and congratulations to Dr. Singh. And I want you all to have a great weekend, and I can't wait to see you next week.